Hello everyone and welcome. I'm Carol Preston. You can hear all the hubbub in the background. We are at ASH 2015 in Orlando, Florida. And one of the diseases that we are taking a very close look at this year are MPNs, and in particular right now, PVs or Polycythemia Vera. David Wallace, I'm a CLL patient. You and I unwillingly or reluctant members of a club that we never anticipated, but here we are.
Yep. And
patients can either stand still or lurch forward and get something done. And that's exactly what you have done. You were since 2009.
Yes, absolutely. So I had found when I was diagnosed in 2009 that the resources that were out there on Polycythemia Vera seemed to be very much scattered around and they were difficult to find. It was kind of like going to Google and seeing 1,000 research reports and not knowing what to believe. And so my goal was to create a website, ultimately pvreporter.com, that allowed patients to come to the website and receive videos, patient stories, news feeds, a custom search engine, and an entire wealth of resources that are contributed by other organizations, patients, stories that I've written, stories that other patients have written, and it really validates the experience that we go through.
And what's the response been? Are patients finding you?
Yeah, the response has been tremendous, so they're finding me. And honestly, this started off as a very small project where I thought maybe I would run it for a couple months and let it float on its own. And I started doing newsletters, and I started getting emails and phone calls and requests to come out and do interviews and whatnot, and it's just taken off from there.
It's become a full-time job.
Yeah.
And it's going to lead to yet another online project.
Yes, so I have found through my journey and through talking to lots of other patients, the first question that typically comes up is Polycythemia Vera a cancer? And a lot of times their doctors will tell them, no, it's really just a blood disorder, you're good. And the truth of the matter is that all of the MPNs, ET, PV, and MF, are all blood cancers, but under the broader umbrella, we're all cancers. And the reason for mentioning it that way is I am starting a nonprofit called npncancerconnection.org, and that's going to be used to help create awareness in the community of the programs that are available to cancer patients, NPN cancer patients, and also to kind of help go as a funding agent for PV Reporter, so it has sort of a dual role.
Nice synergy going on there. Now,
Yes.
You mentioned the question most asked by MPN patients, is it a cancer? What happens if they're told it's not a cancer? Or maybe we should flip that. What does it mean if it is a cancer once they learn that it is a cancer?
Well, in my mind, a lot of it has to do with how they've come into the illness. If somebody was diagnosed and it just showed up on their blood results, it's not really a big deal because it doesn't feel that way. It doesn't feel like cancer. But if you've come into the world of NPN like I did and had a hematocrit of 69 and almost dying from chest pain, it feels and looks like a real cancer. So I think the way that we are birthed into the disease has a lot of how we look at the impact on our lives.
But in addition to that, practically speaking, if it's diagnosed as a cancer, then patients are eligible for a lot of things and services that if it's not called a cancer, they will not.
Yes.
Including, tell us.
Yeah, and so that's an excellent point. Because of the role of the cancer diagnosis, patients in many cities have access to programs that might include financial assistance to be able to go see an NPN specialist, flight assistance, exercise programs, nutrition, one-on-one counseling with an expert. There's, Tai Chi, yoga, lots of programs that are available for cancer patients.
So if you're a patient and you're told you have this MPN, it's not a cancer, what is the question that, beyond is it a cancer, that patients should push for with their doctors?
If their doctors tell them that it's not a cancer, I'd look for another doctor. Yeah.
So that's the long and the short of it.
Yeah.
Well, and so just one quick question about ASH. Here we are with all of these streams of people behind us.
Sure.
What is standing out for you at this meeting? What's exciting you?
What's exciting me is looking at the combo therapies that have been announced, in particular the good results that have been mentioned for the combination study of ruxolitinib and Pegasus interferon. I'm actually on that combo myself, so I have a vested interest in that study, and the results have been very good. So there's numerous combo studies out there, and I think that that's where the future is heading in the MPN world.
Well, David Wallace, we want to thank you for everything that you are doing for PV patients. And to our PV patients who are watching this, PV Reporter and MPN Cancer Connection, mpncancerconnection.org, coming soon, website under development, to stay tuned and up to date. I'm Carol Preston at ASH 2015. Thanks for watching.